Welcome. Hello, and thank you for joining us today. I'm Erica Harquist, Media Public Information Officer for the Oregon Health Authority. Today, we're providing an update on the very latest developments in the COVID-19 pandemic here in Oregon. And joining us today is Dr. Dean Sidelinger, State Health Officer and State Epidemiologist, Colt Gill, Oregon Director of the Department of Education, Dr. Peter Graven, Director of the Oregon Health and Science University Office of Advanced Analytics, and Dr. Dana Harganani, Chief Medical Officer. Now, as always, this is an opportunity for members of the media to ask their questions and hear from our experts. The public is encouraged to ask questions during our Facebook Live events. Now, we have posted a link to the YouTube site in the chat of this Zoom, where the recording of this will be immediately available after it's over, following this news conference. And the public is also encouraged to check out that YouTube site as well. We will be taking questions no later than noon today. We're going to wrap things up by the noon hour. And if you'd like to ask a question, please indicate your news organization. That's key. We need your news organization on there. And then use your raise your hand feature function, and I will add you to the queue. Okay, let's get things started. Dr. Sidelinger.
Thank you, Erica, and thanks to everyone who's joining us this morning. We wanted to meet with you following our Monday announcement that we will lift the mask requirement for indoor spaces by March 31st and for schools on March 31st. Just because the mask requirement is going away doesn't mean masks are going away. Many Oregonians are still at higher risk and may continue wearing masks. Those who are unvaccinated, those who are immunocompromised, those who are at higher risk for complications, those who live with someone in one of these categories. Many may still feel anxious and want to continue wearing a mask in indoor crowded settings. We should all go forward with patience and grace as we move into the spring and support each other's decisions. Director Gill can answer your questions about how our schools can prepare to implement masking changes and how parents and local communities can get ready. Dr. Graven can address your questions about the latest COVID-19 modeling and what lies ahead. But first, let me briefly review the present COVID-19 situation in Oregon. The worst of the Omicron surge appears to be behind us. The virus is losing momentum, but we are not yet free of its grip. Newly diagnosed cases of COVID-19 have fallen 71% from the peaks we experienced only 3 weeks ago. Test positivity, while still alarmingly high, is also declining. Daily COVID-19 related hospitalizations appear to have crested in late January at a level just below the Delta peak and are steadily subsiding. On Monday, we reported 1,072 daily hospitalizations. Today, we are reporting 947, following 21 consecutive days of 1,000 or higher Oregonians in the hospital who've tested positive for COVID. My thoughts go out to all of our loved ones and neighbors who are still battling this virus. These trends are welcome, but we are far from out of danger. Our hospitals are still relying on about 1,300 National Guard members and nearly 1,200 medical professionals that Oregon has had to bring in from other states to provide needed patient care. As infections continue to slow, we anticipate that daily hospitalizations will remain high for several more weeks before returning to pre-Omicron levels. Recall that when we first sounded the Omicron alarm last December, credible projections called for hospitalizations to be more than twice as high as we've experienced. Thankfully, we never realized that dreaded breaking point. Why? Because Oregonians stepped up, as they have throughout the course of this pandemic. Thank you. You got vaccinated and then boosted. Thank you. You wore masks, restricted your gatherings, and avoided unnecessary travel. Thank you. In short, your adherence to these prevention measures blunted this latest surge. Your efforts have saved lives. Thank you. Our emergence from the Omicron onslaught depends on our continued diligence over the next 2 months. We cannot risk squandering our hard-earned progress when a return to normal life is finally, and at long last, within our reach. COVID-19 will not be gone, but we will not have the profound impacts on our daily lives that it still has. That is when we can live with COVID. And with that, we're happy to take your questions.
Thank you, Dr. Sidelinger. Our first question comes from Julia Silverman with Portland Monthly. Go ahead, Julia.
Hi, thank you so much for taking our questions. I have a couple, but my first one is about the number of people in hospital that are there for COVID versus those who are with COVID, as indicated by Dr. Graven's forecasts. I'm totally clear that those who are in hospital with COVID are still straining the system, and that their conditions could be complicated by the fact that they have COVID-19. But I'm just wondering how, if at all, that figure impacts the 400-person hospitalization level that we are trying to reach before the mask mandate can be lifted.
Julia, thank you for that question. This is Dean Sidelinger. I'll start and then turn it over to Dr. Graven if he wants to add anything. When we looked at the data and the impact on our healthcare system, we looked at that number of COVID positive people with COVID positive tests who are in the hospital, regardless of whether they are there with or for COVID. Knowing that at that level, the professional care that the staff has to deliver, the impacts on personal protective equipment and on isolating that patient, whether or not they are there with COVID or for COVID, are the same. We know that for many people who are initially presenting with a diagnosis that doesn't appear to be COVID, who test positive for COVID, COVID may be a contributing part of their condition. So we are following that number of 400 people with COVID in the hospital, regardless of the reason for admission. Dr. Graven, would you like to add anything?
Yeah, I mean, the reality is, we don't have a good measure of who's really there with or for COVID at any point in time. So I think, there's just kind of a technical reason why, it's hard to dig into that and know, every hospital to know, you kind of don't know for sure until after the fact in many cases. So being able to measure that in real time isn't very easy, but I think, it does give some, I would say a little bit of a cushion to the number, which just means, yeah, we don't think there's more incidental than before. I think we know that to be the case. The reality is there's been incidental all along though. And so we've had these, and I know the chart kind of shows that progression over time. And so it is more than before, but I think not knowing it for sure for every patient and for sure for every hospital makes it hard to kind of use that as a particular metric to go by. But we do look at other states and other countries that have kind of been analyzing that in more detail. And, I think our estimates are around half right now.
Thank you for that question. Our next question comes from Genevieve with K2. Go ahead, Genevieve.
Thank you for taking our questions today. I have just a few questions for you. The first one has to do with the mask mandate in school. So we know that OHA is lifting that mask mandate on March 31st, but you have OHA saying the mask mandate is getting lifted, and then you have ODE saying it still strongly recommends masking in school, as well as CDC saying the same thing. So how are the districts supposed to make this choice when the two agencies leading them are essentially in conflict?
Thank you, Genevieve, for that question. I'd like to clear some things up because I think the two agencies have been working together and continue to work together on this. From a public health perspective, from our colleagues at the Centers for Disease Control and Prevention and here at the Oregon Health Authority, as well as our education colleagues at the Oregon Department of Education, we see universal masking in schools with the current spread that we're seeing in our communities as a key foundation of our multi-layered strategy to keep all students and staff safe from getting COVID while they're in school. Universal masking allows protection in two ways. The individual who may be ill and not know it, wearing a mask will limit their possibility to transmit it to others. And with others in that setting wearing a mask as well, they will be protected from the disease. We've done a lot to work on some of the other layered mitigation measures, such as vaccination. There are requirements for staff and adults in those settings, and we've been working with schools, with public health and healthcare providers to get more students vaccinated. Protocols have been put in place to increase airflow and circulation, to keep kids spread out when possible, to offer testing on site to try and identify cases early and respond early, and these other measures will continue in place. On March 31st, while we might still recommend masking universally in these settings, we know that some communities We'll look at the conditions on the ground, other measures they've put in place, their vaccination rates, the rate of spread in their disease, and may choose to go to a situation where masks are optional in those settings. But ODE and OHA, along with our federal partners at the CDC, remain committed to providing the best protection against COVID in schools, and universal masking at the level of spread we're seeing currently across the state is still a recommended intervention. Director Gill, would you like to add?
Yeah, thank you, Dr. Sidelinger. I think just a little bit more, I fully agree. The agencies are aligned, and what I would like to emphasize in that is that I think that we have modeled something that I would like to see school districts move forward with after March 31st. So at the Oregon Department of Education, we know that we are not public health experts. We hope to be strong supporters of reaching our North Star of having all of our students be served through in-person learning every school day this year. And to do that, we rely on information from the CDC as it's interpreted by the Oregon Health Authority for the context that we're experiencing COVID-19 here in Oregon. And the Oregon Health Authority has been incredibly helpful in helping us understand both this national perspective on COVID-19 across the country and what that needs to look like to support in-person learning here in Oregon. Now we're taking this to the next level. So beginning March 31st, we think we will be down from this Omicron surge to a significant level where local public school districts and charter schools and private schools can make independent decisions based on their COVID experience in their communities. And we hope that they are able to collaborate closely with local public health to understand what the COVID impacts are and take a close look at both how their communities impacted, but how the physical space that they operate school in can help them make decisions around which of those layered mitigation protocols need to be emphasized. So whether that's universal masking, mask choice, physical distancing, the airflow and ventilation, all of those are critical tools that we have to decrease the amount of COVID that gets spread through schools and help keep our students in school. And so we need those partnerships to remain strong at every level as we move forward through the pandemic.
Thank you. And I hear you both saying that you are on the same page with this, but the reality is that this notice came down from OHA that masking was going away. And then right after, ODE sent this message filled with, basically reasons why masking should stay in place in schools, or the burden that getting rid of universal masking would place onto school districts. I just got done talking with PPS, and they do feel conflicted because they feel like there is differing guidance coming from the two agencies. So can you provide some clarity for those districts who say, we don't really know what to do because we feel like we're being pulled in both directions?
I will start and then hand it over to my colleague, Director Gill. I think what is happening on March 31st is that the statewide requirement for universal masking in schools will go away. A layered mitigation approach to offering multiple layers of protection to protect students and staff in schools, including those who are most vulnerable for complications from COVID, need to be in place for schools to be successful and to offer consistent in-person learning for all students in that setting with low risk of transmission of COVID. At the levels we're seeing now across the state, and with the levels of vaccination we have and the other measures that schools have taken, universal masking right now makes sense to get us through this surge as we come down from the height of the Omicron peak. But we know with the projections, the trends and data that we're seeing, that cases will likely be significantly lower at the end of March. We have several weeks to get to that point for schools to assess other protective measures, for parents to work with their healthcare providers to get their students vaccinated or get up to date with vaccines so that there's additional protection in place. But in communities with high levels of transmission, particularly if they have low vaccination levels, universal masking is a very effective tool to protect all individuals in schools, and schools should take that into account as they make decisions about what going forward from March 31st looks like. Is there a mask requirement in place for their school settings? Can they go to mask optional because other protective measures are in place and the situation on the ground supports it? That's the message that we're giving to our local public health authorities on the public health side. And I think that's the message that Oregon Department of Education is giving to our school partners, because we are all aligned with keeping the opportunity for consistent in-person instruction with low risk for all students across Oregon. Director Gill.
Thanks, Dr. Sidelinger. I think all of that is accurate. And again, one maybe addition to this is that these are complex decisions. And as we have been operating with some state requirements in place, we have built the recommended protocols for districts around those statewide decisions. So when we had statewide universal masking in our schools, the protocols that we were recommending to school districts were all built around that fact. So what the Oregon Department of Education shared with school districts was to make sure that they understand how the different health and safety protocols work when you're in a mask optional setting versus a universally masked setting, so that they're taking all of those considerations into account as they develop what they want their local rules to be. These are the decisions that the Oregon Health Authority and the Oregon Department of Education have partnered on for the last several months as we've been operating school this year and in previous years. And now we're transitioning these kinds of decision-making challenges to our local school districts and local public health authority. But we're doing it at a time when we know the transmission will be at a much lower level, like it was before Omicron. And we think that we're giving folks the tools that they need to make those decisions locally. What we don't want to do is to have our school districts make these decisions in the absence of the kind of information that we've had at the state level. So we're sharing that back down with our school districts.
Thank you for those questions, Genevieve. Our next question, also from K2, comes from Megan Allison. Go ahead, Megan.
Hi there. Thank you for making the time. So one question that we've heard from the public is, how do you plan to adapt with masking if there's increased transmission or another variant in the months ahead?
Thank you for that question. I think what we have to remember about COVID-19 and SARS-CoV-2 that causes this infection is it's been unpredictable. We've seen variants and mutations in this virus from the start. What we know is we have not seen a new variant arise here in Oregon initially. We've been able to see the beginnings of its impact in other states, other countries, other communities, and make changes to our recommendations ahead of that. We continue to monitor the situation. Right now, what we're seeing is Omicron has moved for other communities fairly quickly, as it seems to be moving through here in Oregon. Very transmissible, but also peaks fairly early and comes down. There are no other variants of concern right now on the horizon that we're worried about, but we'll continue to monitor that situation. If we see disease rates increasing in other communities here in Oregon, a variant of concern that appears to cause more severe disease or evade our immunizations, our vaccinations at a higher rate, we will message to people what's happening, so that individuals, particularly those who are at highest risk, may start changing their behavior ahead of that, may start wearing a mask again, thinking about postponing plans. If we're seeing increased cases, impacts on hospitalizations, we may make those recommendations across the board for everyone. And if we get into a situation where hospitals are in crisis, we'll have those conversations about, do we need to go further? But the tools we have in front of us now are different than they were 6 months ago, than they were 12 months ago. We have highly safe and effective vaccines. These vaccines work remarkably well against Delta and Omicron that weren't even around when they were developed. We now have the availability of oral antiviral pills. These are medications that people can take once they're sick to prevent the severe complications and to prevent them from needing to be hospitalized. Right now, unfortunately, they're in short supply, but we anticipate that supply will increase and we'll have that as a bigger tool. We continue to have monoclonal antibodies available. One of those products is effective against Omicron. So we have additional tools available that we can help to blunt this surge. And we know that Oregonians have stepped up in the past when they've seen what's happening in other communities, when they see what may be starting in Oregon, and they've taken actions on their own. So I hope not to be in a place where we need to talk about, do we need to use this tool again? Because I don't think we'll get there.
And as a quick follow-up, if a mask mandate is lifted and then returns, are you worried about compliance in that scenario?
I think we're always worried about compliance. And so whether it's a recommendation or a requirement we put in place, we know that's only as good as having people follow it. And we've shown time and time again here in Oregon that the approach we've taken, the acting based on the situation, looking at the data, changing with the situation, the tools in front of us, and the steps that Oregonians have taken have really done a tremendous amount to decrease the impact of COVID here in Oregon. We've had some very painful last few months as we went through Delta and Omicron. We've lost far too many Oregonians to this virus, but things could have been much worse if people hadn't stood up and taken the action to protect themselves, their loved ones, and their neighbors. And for that, I'm eternally grateful to the people of Oregon.
Thank you.
Thank you for those questions, Megan. And nice to see your face. Our next question comes from Isabella Garcia with Portland Mercury. Go ahead, Isabella.
Thank you. I'm just wondering, when do you expect those additional National Guard members and traveling hospital staff will no longer be needed in state hospitals? Will that be before March 31st or is that after?
Thank you for that question. I think as we see the number of patients in the hospital with COVID-19 and the overall censuses go down, we'll start to be able to look at those resources and draw them back. Those initial conversations about what level we need to see before the National Guard is demobilized are happening. And we're also in the process of looking at those out-of-state healthcare providers who are currently assisting in hospitals, how we can keep some of them in the state, transfer some of that responsibility to hospitals so that we can help out the workforce as we move into year 3 of battling COVID-19. You know, our healthcare workforce is fatigued, our public health workforce is fatigued, our educational sector workforce are fatigued. So we know that these staff will not likely go away, but we'll be able to shift them and use them in a more routine manner, as our hospitals often do during respiratory viral season, during influenza seasons, and not have the huge number. So I anticipate you'll start to see some redeployment of those staff, some drawdown of those staff over the next month to month and a half. And when we get to the end of March, when we predict those numbers are down, we're going to see much less outside support in those hospital systems.
Thank you for that question, Isabella. Our next question was submitted into the chat by Lisa Balick of Coin6. She asks, why roll back mask mandates right after kids get back from traveling and socializing during spring break?
I think there's never any ideal time to start rolling back, and it won't look the same across the state. So I think as we talk about returning mask requirements or mask usage in schools to local control, this mirrors a discussion we had about a year ago when most requirements that were in place in the original Ready School Safe Learners went back to local control. We hope that districts will look at their calendar when spring breaks occur, when people may be coming back, and if they anticipate some increased spread then, that they may continue a mask requirement or make their changes with that in mind. This is why, with making the announcement when we did this week, with 7 weeks lead time, this gives our parents and families some time to make plans. This gives our schools time to make plans. This gives other businesses and organizations in the community a chance to make plans so that we can move forward together with the best information we have, with policies in place that continue to keep everyone safe. Director Gill, would you like to add?
I think that covered it well, Dr. Sidelinger. Thanks.
Thank you for that question. And Lisa Balick, I understand you have another question, and we are going to hear from you with that follow-up. Go ahead. It might require an unmuting. Go ahead.
Good morning. I think we've got it now. Thanks. The follow-up question is, if the state doesn't have any specific guidelines for school districts in terms of making a decision come the end of March, in terms of number of cases in the community, number of hospitalizations, say in the county, how can the school districts really make an educated decision rather than one based on public pressure?
I think again, to go back to some comments from Director Gill, you know, at the state level and at the local level throughout this pandemic, we've had public health and education sectors working together. We anticipate that as we move to the statewide mask requirement being lifted in schools, that those conversations about the benefit of masks, whether a universal rule is in place, will happen. Those conversations will heat up at the local level. In terms of guidance, we can look to the Centers for Disease Control and Prevention that spells out some things that could be looked at to ease certain protocols in schools as cases go down. They state that schools, that communities should be in the lowest level of transmission and before certain safety measures are rolled back. Schools can use that, our local public health can use that as a guideline. Other things that will play into the impact of COVID on schools as cases come down are things like vaccination rates, things like the other measures that are in place from ventilation, air filtration, how well they're able to keep students apart, and how successful they've been at combating keeping COVID from spreading in their schools over the last year and a half. So there are some frameworks out there. We're not going to set specific benchmarks for schools because each situation is very different and depends on multiple things coming together. So as school officials make those decisions, they will hear from parents, they will hear from families, and hopefully they will hear from local public healthcare providers in their communities and make the decision that's best for their school community.
Thank you for that question, Lisa. Our next question comes from Mike Benner with KGW. Go ahead, Mike.
Thank you, Erica. Again, Mike Benner with KGW News, and thank you for taking our questions this morning. Obviously, this press availability in the last few days has, have been dominated by the talk of dropping the mask mandate. But I think something we're not discussing is that there's still a number of people in our community. I'm talking about those, 5 and younger or whatnot that have not yet been vaccinated. So I guess first of all, I have like a 3-part question, I guess, if you will, under that umbrella is A, do you have any insight on when these our little friends, if you will get vaccinated? Is there any sort of direction to preschool and daycare providers? And thirdly, and when I mean that, in any information to them as far as should they continue masking in those environments, but then also concern that parents might have regarding maybe their older children who are getting vaccinated, or who are vaccinated but dropping masks in school, but then they have a little one at home. I think that there's some concern among parents as far as that goes. So yeah, if you guys can touch on that, that'd be great. Thank you.
Thank you. As far as vaccine availability for children less than 5, so 6 months to less than 5, we do anticipate that the CDC advisory, we do anticipate that the FDA's advisory panel will look at the data on effectiveness and safety in that population next week. We'll make a recommendation to the the Food and Drug Administration, who will then make a decision. After that, the independent advisory committee to the CDC will make recommendations about the use of vaccine in this age group, and then the CDC director will ultimately review all that data and make a decision. The Western states come together and have independent academicians, scientists review the process to either affirm or not the recommendations that are made at the federal level and send that information to our governors of our respective states so that we can weigh in and implement vaccination in the best way possible based on the data and the science that we have. So I would anticipate that possibly by the end of February, we may have vaccines available for those 6 months to 5 years old if the preliminary data that we've seen shared holds up. As far as having that population not be protected, I think parents have been in this situation for a couple of years now. And everyone really has been in this situation for a couple of years now. We need to look at what are our risk factors. So individually, are we up to date on our vaccines? Are we healthy? Are we an older Oregonian who may be more at risk for COVID-19? Are we immunocompromised? So even if we're up to date on our vaccines, it may not work as well. We may make different decisions than someone who's healthy and fully up to date on their vaccines. We make decisions not in a vacuum, but who are our household members? Who's in our family? Do we have younger children who are not vaccinated? Older relatives that we're caring for that are at higher risk for complications? Do we work in a setting that's quite crowded and we have several colleagues who are at higher risk for disease? We may make different choices about continuing to wear a mask, postponing activities during times when COVID is spreading quickly throughout our community, and make those decisions together. So as we have been talking to our Oregon Department of Education colleagues, we continue to talk to our Early Learning Division colleagues. And so, we have conversations with them about what do protective measures look like in those settings. So we'll continue to follow the federal timeline as, those vaccines reviews happen as recommendations come out, follow the Western states timeline to review that data. And when those vaccines, when and if they become available, we'll make recommendations. And that may change the calculations for several families that have young children. That may change the calculation and the factors that are in place in our early learning division and childcare settings.
Thank you for that question. And our next question is a follow-up question from Julia Silverman. Go ahead, Julia.
Thank you so much. This question is actually for Director Gill, if that's okay. Director Gill, obviously the CDC has been very clear that universal masking in schools can help reduce the transmission of COVID-19. I'm wondering whether you have been watching at all as sort of a small but growing number of pretty well-respected public health experts has been suggesting that, in fact, universal masking in school may have less efficacy than previously considered, particularly as sort of community spread goes down. They've been raising concerns about, the trade-offs of, that it can have an impact on reading comprehension for youngest kids, that it can be difficult for kids who are trying to work on developing social and emotional skills or limit their abilities to make social connections. I'm just wondering if you find any basis in fact at all for some of the people talking about the trade-offs of universal masking in a school setting.
Yeah, thanks for the question. I do think that universal masking is clearly something that is new to all of us, and we'll all have to continue to watch studies as they come out. I have been looking at studies on that purport some different results. Nearly all of those studies that have gone through peer review do name that universal masking does reduce the spread of COVID-19 in the school setting and does help make that a safer space for all and keep schools from contributing to community spread. And I also look frequently to our Oregon Health Authority to review those kinds of studies and give us information back. So I am very confident that universal masking has helped Oregon maintain in-person learning this year and can continue to do that when we have surges like we have currently in place right now in Oregon. As we come down, I do think that we have more opportunity for, again, districts to make local decisions based on their COVID-19 experience to make masks optional. And so we will be able to see more as in Oregon, we begin to have schools that are taking different approaches to this and seeing how that impacts both the physical health of their school community and as you're speaking to the social emotional health. I have not seen many studies that have pointed to what you're talking about. There are instances where people discuss the possible impacts of masking on learning to read, on building speaking and literacy skills, on social emotional well-being. And many of the folks who speak to those still believe that being in person in school is a benefit over not being in person, being in an online setting. For social emotional wellness, for building literacy skills and speaking skills, that our ability to be together with the teachers and with peers is what's really critical to helping our students be able to pick up those skills and learn. And if universal masking has helped us keep that in place, and we've done a really good job in Oregon of maintaining schools that are open to in-person learning all school year, then I think that that's what's critically important right now.
Thank you. And if I could just ask a quick follow-up, and this might be more for Dr. Sidelinger. I'm wondering whether OHA has a position on the benefits of one-way masking and whether that can be helpful or essential for, keeping those who are at particular risk of COVID-19 safe, and what the agency's guidance on that is going to be going forward. Thank you so much.
Certainly wearing a face mask on an individual does offer some protection. So for an individual who wears a face mask, if they are sick, even if they don't know they're sick, that can act as source control, meaning that they are less likely to transmit that virus to others. A well-fitted mask, a quality mask, 2 or more cloth layers, polypropylene, some other kind of material that has some static qualities, also offers protection to the wearer. So yes, one-way masking definitely offers some protection. Two-way masking, particularly at a time when disease rates are high and we're in an indoor crowded setting, offer even more protection. So again, it's back to the multiple layers of protection and back to the individual factors that we all have, the household factors that we return home to. We will, many of us will make different decisions based on what's happening in our community, based on what's happening in our household, based on our own health and vaccination status. And one-way masking offers protection to the individual. One-way masking offers protection to those around you. But at times when disease is spreading in a fairly high level, two-way masking offers even more protection. That, along with being up to date on vaccinations, are our best tools to get through these times when we have higher disease spread.
Thank you for those follow-up questions, Julia. Our next question is also a follow-up from Genevieve, again with K2. Go ahead, Genevieve.
Thank you. Sorry, I keep trying to unmute myself, but you're doing that for me. I appreciate that, Erica. I have a follow-up, one follow-up and then one question from a colleague who couldn't be on this call. That question has to do with what happens on March 31st. So we know that there's the potential that districts will remove that masking mandate, but what is ODE doing right now to stop a school district from defying the mandate? And we know there is at least one school district that is openly defying that mandate. Is there anything ODE is doing to crack down on districts to not make any changes prior to March 31st?
Again, I think I would back up to the reasons why we have asked everyone to hold off and why we've given the date of March 31st in the first place. So what we know right now is that while we are coming down from the very highs that we experienced during Omicron, we're still having a significant number of cases reported each day. We still have nearly 1,000 people in our hospitals. This is really not the time to stop universal masking in our schools. This is a time when Omicron can continue to spread rapidly through an indoor setting, when people are spending a lot of time together in close quarters inside a school building. We do believe that the modeling will hold true, and Dr. Graven can speak to what that modeling looks like in the coming months and weeks. But we believe that modeling will hold true, and we will be in a different place in Oregon by March 31st. And that's a time when we ask districts to consider whether the universal masking is something that they should continue in their local school districts. We think that school districts also need time to consider this. So, you know, every single person in our school buildings is important. And part of what we do in school every day is for the protection of every single individual. Our school districts reflect our broader communities and the vulnerable populations that Dr. Sidelinger has talked about, the unvaccinated, the immunocompromised, those with underlying health conditions. All of those individuals exist in our classrooms and in our schools and report there every day. So our school districts need to have thoughtful conversations about the impacts of moving away from universal masking and what that will look like for every individual that they serve. They also need time to talk to their staff and make sure that those staff feel comfortable interacting with dozens of students and individuals every single day. They need to have discussions with their community. They need to have those really critical discussions with their local public health officials to understand how COVID is operating at the end of March and the beginning of April in their community, so that they can alter their protocols to make sure that they have steps in place to control spread, to reduce spread in their schools. And then most importantly, our families who maybe have not yet made the decision to vaccinate their children need time to consider that and to go get a vaccination for their child. Our children who are unvaccinated, when they become close contacts, they have to quarantine from school. That means they're missing school in-person learning time. If they're vaccinated and they come into a close contact with another individual with COVID-19 and they don't show symptoms, then they can continue to come to school. And that's what we want to protect. We want to protect that access to in-person learning for everyone. So that's the reason behind having the date set out at March 31st. This is, again, because of where we're at with the Omicron surge in Oregon. This is not the time to remove masks early. We are in contact with school district leaders across the state on a regular basis. We're encouraging them to maintain compliance with the current Oregon Health Authority rule on universal masking in schools. From the Department of Education, one of the things that we have a responsibility and authority to do is to distribute the federal assistance dollars for COVID-19. This helps our school districts operate differently under COVID-19. It helps them tackle things like improving airflow and ventilation. It helps them bring in more mental health and counselors and those kinds of supports for our students. These funds required school districts to assure that they would continue to follow federal and state guidelines and rules and laws. And currently, until March 31st, the law in Oregon is to maintain universal masking. So until that law changes on March 31st, those schools cannot draw down from those federal funds. Oregon OHA has other responsibilities to protect the health and safety of employees, and they will also look into instances where school districts make decisions that are do not appear to be in compliance with the state rules. And the final thing I would say around this is that a school board or a district leader who chooses to fall out of compliance with this rule is putting their staff in a very difficult position of wanting to follow the guidance of the leadership of their district. As they do on a day in and day out basis, they follow the guidance and leadership of their elected school board and their superintendent. And they also operate within the laws of the state of Oregon. And when those two things are at odds, you're putting school employees who have worked very hard for a number of months to serve our students and our families in a very difficult position of choosing whether they are going to follow the laws of the state of Oregon for the next 6 weeks, or whether they are going to follow a direction that's in conflict with that law of their local leadership. So I would ask that we have a date, it's named, and our school leaders who are anxious to move away from universal masking know that that can happen on that date. And I'm hopeful that they can move with us and keep it in place for the next 6 weeks as we come down off of this surge.
Thank you, Director Gill. I appreciate that. I have one quick follow-up question. If schools do get rid of universal masking, as noted directly from ODE, there will be more work for those districts and more absences from students and staff. That's because of the current RSSL guidance. Is ODE changing that guidance?
The short answer is, will guidance change? Yes. Guidance has continually changed throughout the pandemic. In relation both to what we learn about how to best mitigate COVID-19 and in relation to the current circumstances on the ground. So what you just said, I believe would be very true if masks were to come off today. So if we were to say masking is optional right now, as we're still in the midst of our Omicron surge, albeit coming down, but still in the midst of it, we would see more students both contracting COVID-19 from one another or being exposed to it and having to quarantine and miss school time. At the end of March, we should be in a very different place with the surge. We should be at much lower community transmission rates. We should be at much lower hospitalization rates. So we will have the possible impact of when an individual comes in contact with someone with COVID-19, they would have to quarantine if they're unvaccinated. We should also see far fewer cases of COVID-19 enter the schools in the first place because our community spread will be at a much different place. When we work with the Oregon Health Authority, and I'll turn it over to Dr. Sidelinger if he wants to add any information here, we will be looking at what is Oregon's current experience with COVID-19 at that point, and do we need to make any changes to the protocols that are recommended for schools?
Yeah, thank you, Director Gill. I will say, I think, the Oregon Health Authority and the Oregon Department of Education, we started having these conversations. We had these conversations even before the announcement, and we're reaching out to our local partners, our local school and education partners, and our local public health partners about what is the burden of responding to COVID in schools like right now. What do we anticipate it'll be like at the end of March when cases are lower? And what impacts would lifting the mask rule have on the number of students who may potentially be exposed or need to quarantine? So we anticipate needing to look at all of those guidelines and say, are there changes we can make if spread is lower and universal masking is not in place that don't significantly increase the risk of transmission in schools, still offer protection to those individuals most vulnerable in schools, but also don't increase the administrative burden or mean significantly more people will have disruptions to in-person learning. It won't be an on-off switch where all the rules kind of go off. But are there some changes we can make to the rules? Are there some changes we can make that don't increase risk about exposures, about when people can come back into schools that won't have significant impacts on in-person learning, but also don't increase that transmission? And this timeline of having universal masking in place while we come down from this surge until the end of March allows time for all folks involved to make these plans, to have systems in place, and to be ready to respond on March 31st, when some schools will look different with masks not universally required, but many students and teachers probably still choosing to wear masks in those settings. So what does that look like? We have some time to get the best plan in place.
Thank you for those questions, Genevieve. And we have a question from Ted Sickinger with the Oregonian. Ted, I'm presuming you'll probably want to speak to Dr. Graven. Go ahead.
Good guess there. I am wondering, what are the community transmission rates in hospitals? I haven't looked at the model yet. And, all this seems to be based on where you believe the virus will be at that point. And, the political reality is that the minute this requirement is lifted, districts in some areas of the state with the lowest vaccination rates will immediately jettison the requirement. So there must be a pretty high degree of comfort that we're going to be in a very good place at that point. And I just was hoping that Dr. Graven could kind of address where he believes we will be, as I haven't had the chance to look at his model yet.
Yeah, happy to answer that, Ted. At the beginning of the surge, I started doing the modeling, and I thought, I can tell pretty close when the date was going to be that we're going to peak. I was a little unsure of the level, and I was pretty clear with folks about that, and that mostly came in true. I think it ended up being lower than we had originally expected, which really was due to behavior impacts. You can actually pull that out of the model pretty clearly. Now going into the downslide. This is where the model sets in a lot more confidence. I'll be honest. It's a lot easier to predict these declines. We see a lot of states ahead of us, a lot of countries ahead of us, and what they're doing and the pattern there. So I have a fair bit of confidence in it ends up around 400 at the end of March. I think that'll be pretty close. If we look at what's happening in the UK, they had their peak and they lost about 35% of their hospital census in a month. So I think, all signs are that those kind of drops are certainly feasible. So I think the forecast should go well. Of course, assuming, this is assuming that kind of the regular amount of fatigue and not, drastically changing. If we got rid of mask mandate today, that projection does not hold. And therefore we would, we'd see something else. And I tried to put that in the forecast. I don't know if you've seen that, but, there is still a lot of people, there's a lot of infection. And, of course, my job is really to make sure that if people are getting infected, that we have a hospital bed for them. That's the point of the forecast. And, we're full. And so if you talk to any of the major systems, there's a lot of procedures that still can't happen on a daily basis. Everyone's going to try to make room for people, but this is not the time that you'd want to get sick with COVID. One day it's going to be endemic. You'll probably get it. This would not be the best time for it. I would want you to get it when we have more space in the hospital. Make sure you get the best recovery possible. Other issues are going to be addressed as well. So in terms of the model, yeah, I think, this isn't a great, I think that if we can hold out to March, the impact then of dropping the mask mandate, when I look at it there, I don't see a big effect. You know, if we behavior changes some, then we'll be at a low enough level that we should be able to manage it.
Okay, I just, as Pat Allen said a few weeks ago, that we're probably at this point capturing 1 in 10 infections. You know, do we really have a good sense at this point of you know, we talked about the, I can't remember what the exact figure that Dean used earlier was, maybe 71% cases having dropped or something like that. But do we really know that at this point in terms of the infection rate? Because again, the word was because so many people are testing at home, because we have so many asymptomatic cases that we don't really know what the level of disease is.
Well, I would say for modeling, I agree with you that that you know, the number of reported cases is not our best metric actually of how much infection is out there. We know that there's standard, almost really a multiplier that we apply to that case count if you wanted to know. And I actually don't even use the cases in the model at all. So my model is built entirely on the hospitalized census, because we know that, you know, a certain number of people, when they get infected, are going to end up at the hospital, whether or not they get tested or not. They will get tested once they get to the hospital. And so I use that as a real pattern. And from that, you can kind of back out how many people are infected based on that. And we know it's really high. You know, I would say, I think my model is showing like 8% of Oregon is infected or has been infected in the last 14 days. Very high percentage. And so, you know, one of the highest we've had. So those, but you know, do they all know it? No. So I think your point there, and if they got tested at home, do we know it? No.
Thanks.
I'd just like to add to that. Thank you, Dr. Graven, for that explanation. I think we've always known that our reported cases don't represent the entirety of disease, particularly with people with no symptoms or with very mild symptoms. During times of surge, we pick up even less, particularly with a variant like Omicron that is less contagious. But the trends that we're seeing in data, so decrease in the number of reported cases, the trends that we're seeing in percent positivity for those laboratories that are required to report to us, that kind of pool hasn't changed. That percent positivity is going down. And then for the pieces of data that we can be even more confident in, those number of patients in the hospital who test positive are also going down. So all of the data together point to trends that we are dropping in our cases here in Oregon. And we've seen that in other communities as well. So we can feel fairly confident in our forecast over the next couple of months. Can I be confident in a forecast 6 months out? No, but I can be confident, I think, in where we're headed through the rest of February and into March.
Thank you for those questions, Ted. And that was our last question for the day. And in fact, we want to be conscious of everyone's time right now. And as we mentioned, we have a hard stop at noon. Please remember to email the OR COVID-19 media email if you have any follow-up questions. We're happy to take those and answer them and work with you. But for now, I will toss it to Dr. Sidelinger for some closing remarks. Thank you again, everyone.
Yeah, thank you, everyone. I want to provide some clarification on Pfizer vaccine availability for those youngest Oregonians. It appears like the timeline for approval or review and potential approval for that vaccine has been pushed out some. And while that may be a disappointment to the parents of those youngest children, knowing that the data review is being pushed out and that the usual channels of our FDA advisory panel weighing in on the data, our FDA reviewing that data, the independent advisory committee to the CDC reviewing that data, the CDC director making a decision based on that, and then our Western states scientists reviewing that data will be followed. And we hope that if the preliminary data holds true, that as we move into the spring, that vaccine will be available for the youngest Oregonians. I do want to thank, Oregonians for the steps they've taken and the sacrifices they continue to make as we battle Omicron. As a state, we've prevented thousands of cases and likely thousands of deaths due to the collective actions that we've all taken. And we know this can be tough. As we move into a new situation with mask requirements going away and individuals having to make that decision, we know many people are anxious. And so hopefully as Oregonians, we can step up, support each other in our decisions that we make based on our own conditions, the conditions in our household and in our communities. I think, a colleague shared an analogy that I think is really important as we head down from our Omicron surge. When we climb a mountain, it can be a difficult challenge. We use a lot of muscles, we get tired. But that doesn't mean that once we reach the top, things are done. We use different muscles, we get tired, and we work on the way down. And that's the part of our journey we're in now. It doesn't mean we're done battling COVID, but we're battling COVID in a little different manner. And as we head down the mountain, we're closer to that base camp, closer to a time when life is more normal and COVID doesn't dominate our daily lives. As we come down this mountain, we'll exercise some different muscles, but we're going to get through this together as we have in the past. Thank you.